Hi guys, hope you're well. Simple video on 4 things to think about when you do a telephone consultation as part of an assessment like CSA, RCA, PLAB 2 for example, or any communication skills based exam. What to think about if you get a telephone consultation and how to get it off to the right start. So I'll talk about those 4 things, and also at the end of the video I'll tell you about how you can get 10% off any of our communication or role play based exam online courses, our CSA 125, RCA 90, PLAB 2 communication skills online course. How do you get 10% off? I'll talk about that at the end. But let's start with 4 key things to think about at the beginning of a telephone consultation. So the first thing that I often see people miss out when they do telephone consultations is identity. You've got to make sure that you're the right person on the other end of that phone. You don't know if it's that person's brother, sister, mother, father, friend. You can't see them, there's no visual. So you've got to make sure that the person I'm speaking to is the right person. So we talk about checking 2 forms of identity. Usually name is obviously given, but usually date of birth and address. That's what I usually recommend to make sure you've got the right person. Because if you haven't, and then suddenly you realize later on when they go, oh sorry doctor, it's not John, it's his brother speaking, then you might have given away information. You said you have to rethink everything, and it gets you off on the wrong foot. So before you go any further, make sure you check identity, and I talk about 2 forms of identity like date of birth and address, but choose any 2 yourself. Number 2, don't forget to check geographically, where are you compared to this person? This is such a fundamentally important part of a role play consultation. It's amazing in exams how many times people are not where you think they are. Often people just assume, when I'm doing practice role plays with these kind of consultations, people often assume that they're at home, they're talking from home. So they start to make plans, make decisions, base their whole consultation thinking that they're at home. And then maybe later in the consultation, they realize, sorry, where are you again? When they mentioned they're in a different city, or even in a different country, or maybe they're at work. So you're planning, for example, to call them in, or to get an assessment done, or to advise them on a certain bit of information, like go to your local chemist or something. And then you realize that they may be 200 miles away from you. So your whole decision-making process, the resource that you have available, the advice that you're going to give completely has to change in the middle of a consultation. So one thing I'd always suggest is, before you go any further into the real consult, make sure you know geographically, where is this person compared to me? Mrs. X, can I just check, whereabouts are you calling from right now? Mr. X, just so I know I'm right, can I check, are you at home at the moment? Make sure you figure out if they're at work, or if they're in a different city, or even in a different country. Number 3, now this one depends a little bit about whether you're calling the patient or whether the patient is calling you. Now in some exams, the patient calls you and you pick up, you can miss his spit out. But if you're calling them back, or you're asked to call somebody, then make sure you ask before you, if they're okay to actually chat before you go and do a full consultation. So ask if they're okay. It's amazing how many times, again, I do practice with these types of role plays, and people just go, hi, is it Mr. X? They do their identity check, and they're like, right, how can we help? Or I've got some blood results. So you start talking about the consultation, and actually somebody may be, I don't know, in the middle of a situation where they're at work where they can't speak, or they just pulled over because they're driving and they can't speak. So you've got to find out, it's just courteous to find out, you know, have you got a couple of minutes? It's Dr. So-and-so, calling from the surgery. Can I check if you've got a couple of minutes to have a chat on the phone? This is really important. Not only does it check that actually they can do it, and it appears courteous, and it appears that, you know, you're basing things around the realities of life. You've done this before. It shows you've done it before. But also it's a really good icebreaker. You don't have to jump straight into the medicine. You're showing how, you know, you get used to their voice, they get used to your voice, and it shows that actually you're trying to build a bit of rapport before you just dive in and do the doctory bit. So if you're calling somebody in an exam, and not all of them are like that, then make sure you check they're okay to speak before you jump in and get told later on, oh sorry doctor, it's a bit of a busy time actually, can I call you back later on? It really helps. The 4th thing to think about, and again, this depends a little bit on whether they're calling you or whether you're calling them, and this is particularly for people who call you. So you're sitting in a room and your phone rings and you pick up and the patient's calling you in an exam, is to make sure you get a number back to call them back on in case you get cut off. And of course in an exam, it's not going to get cut off, but it's important to show this is something that you do routinely in telephone consultations, because you realize in real life, phones get cut off, and maybe you don't have the mobile number that they're calling you on, and suddenly in real life you'd be a little bit stuck. So again, and number 1, it shows that you've done it before, and it shows a safety thing. But number 2, it again helps to break rapport and build rapport early on. You get used to their voice, they get used to your voice before you jump into the medicine. So for example, once you've done identity, once you check where they're calling from, Mr. X, can I just check in case we get cut off, have you got a number I can get you back on? Again, it doesn't take very long, but it just shows that you're aware of the challenges of doing telephone consultations and the realisms that can happen when it comes to real life consulting on the phone. So try and get a number back to call them back on in case the line gets cut off. So I hope that helps. 4 key things to get your telephone consultations off to the right start. Now, we'll do some other videos about how to do the next part, the middle and the end of a telephone consult later on. But just remember those 4 things depending on whether you're calling the patient or whether they're calling you. Number 1, get the identity in. Make sure this is an important part. Do not do anything until you've got the right person on the phone. Number 2, make sure you know geographically where this person is compared to you. Don't just jump in and then later on realize they're at work, for example, or they're in a different city to change your whole plan. Number 3, make sure that you ask if it's okay to have a bit of a conversation. Are they okay to chat? Are they in the right place? Do you need to call them back, for example? Just shows that courtesy. And number 4, make sure you get a number to call them back on in case the line gets cut out. Again, it shows you've done this many times before and you know the technical issues that can happen with a telephone consultation. Now, of course, this depends a little bit, like I said, on whether you're making the call or whether they're calling you, but it's worth bearing these things in mind for when you get telephone consults, things like CSA, RCA, PLAB2, etc. Now, the 10% off the online courses, CSA 125, RCA 90, and PLAB2 communication skills. These are online courses, half-day online courses, and they cover a variety of different types of scenario. And we talk about how to manage them, whether it's face-to-face, telephone, video, depending on the exam that you do. So have a look at the website, aurora.medicaleducation.co.uk. Have a look at the online academy and watch samples to see if it works. But you get 10% off any of these just by emailing me, aman@aurora.medicaleducation.co.uk. Just say, I watched the video on telephone consultations. Can I have 10% off the online course? And I'll give you a code. You plug it in and you make advantage of that discount. Hope this helps. You know the hashtag can't pass will pass, hashtag I went with Arora. Have a great day.